Hello, today we are going to be doing our pharmacology lab evaluation. So we have three techniques that we're going to be demonstrating: oral administration, subcutaneous injections, and intramuscular injections. So I'll start off with showing the subcutaneous injection sites. So I have a little doll here. So when doing your subcutaneous injections, you're going to want to use the fat in your arms. So right in here, in the back. Your abdomen, your inner thighs, and your butt cheeks. And then for your intramuscular injection, you're going to want to use your ventrogluteal, so that is your muscle on the side of your leg, your vastus lataris, which is your outer thigh, and that big muscle there, and then your deltoid, which is your shoulder muscle. Okay, so for oral administration, you always want to make sure you do your assessments prior. So what you're going to do is you're going to take your vital signs. You're going to ask if the patient has any drug allergies. You're going to make sure that the patient knows of any side effects that the drug may have. Making sure your patient, if they are on other medications that you know, so you don't have any medication contraindications. You're going to want to assess if the patient is in any pain. So asking them on a pain scale from 1 to 10, and then making sure you're getting a health history from them as well. So there's 10 rights to medication administration. So making sure you have the right client, right drug, right dose, right route, right time, right documentation, right history and assessment, right to refuse, right drug interaction and evaluation, and right education and information about the drug. So when you were preparing to give your oral medication, you want to make sure you give it within 30 minutes of the doctor's order, after you've done your 3 checks of your medication and you checked the doctor's orders and you did all your assessments. You want to hold the medication if your vitals are too high or too low, or if you think you have the wrong medication, make sure you stop and make sure that you have the right medication, and asking someone just to make sure you're not giving the wrong medication. So there's 3 checks to medications. So your first one is when you pull your drug out of its storage place, you want to make sure you're grabbing the right medication. Your second one is before you prepare it, you want to make sure you have the right drug again, so that you're not contaminating or using something that you don't need. And then your last check, your third check, is right before you give it to give the medication to the patient. You want to make sure, again, you have the right medication, you have the right patient, right time, right dose, right route, just to make sure you're not giving the patient something that they can't have, or yeah. So that was oral. So now for subcutaneous injections, we're going to be doing insulin. So for that, we need to make sure that we are taking a set of vitals before we give our subcutaneous injections. Making sure that you're taking a blood glucose level test, so that you're not giving insulin if they don't need it. Your blood glucose level test should be within bit parameters, which is 5 to 10 millimoles per liter. Yeah, so when preparing insulin, you want to make sure you have the right stuff. So for this one, we're going to be doing Humulin R and Humulin N. You're going to be needing your insulin needle, alcohol swabs, and then I'll be injecting into an orange. So for this, preparing it, we got to make sure our insulin is ready to go. So we just have our normal, this one, that's our R, and then we have our cloudy insulin, which is Humulin N, and that needs to be shook in. So I will shake this by just rolling it in our hands. Making sure that it is nice and mixed and there's no floaties. Now we will wash our hands again. We're going to grab our alcohol swabs. We're going to clean the tops of the vials. letting that air dry. And we're gonna throw this into the garbage. We will take our needle out of the package and we will get that ready to go. So what we're gonna wanna do is, because we need to put air into the insulin vials so that the liquid doesn't stay in there and it's easier for the insulin to come out. We need to administer the amount of air into the vials that we will be taking out. So for this one, we need 10 units of Humulin R and 10 units of Humulin N. So I will be putting 10 units of air into the Humulin N vial and then 20 units of air into the Humulin R. So we're going to remove our cap. We're going to get 10 units of air and we're going to go right into our Humulin N vial. Put that in straight out, and then we will be putting 20 units of air into the Humulin R. So right in, all the way in. And this time we're not going to take it out. We're going to flip it upside down and take it right out. So we're going to take out 20 units. And then right out. And then we're going to go right into our Humulin N and take out 10 units of Humulin N, totaling 30 units of insulin. Straight out. Now we're going to one hand scoop our lid so we're not contaminating. And we will put the lid back on and let this sit for a second while we prep our patient. So we need to clean our injection site on the patient. So the orange, I'll just clean the patient and let this air dry. Okay, so now that we're ready, we're going to remove our cap from our needle. And because this is a subcutaneous injection, we're going to be going in at a 40-degree angle right into the patients. And then administering slowly at a steady pace. And we need to remove at the same angle that we had put the needle in the first place. So this out. And then now we're gonna, again, scoop our lid back on so we're not getting any needle stick. Put the lid on, and then we're gonna dispose this into the sharps. So now I would document on the MAR, on the bit paper, and then come back and check on the patient in 30 minutes for reassessing. So now we have our intramuscular injections. So this is our morphine that we're going to be giving. It is a PNR medication, so if the patient needs it, they can ask their doctor for it. Because it is a narcotic, we want to make sure that we are doing a full pain assessment on them, because we need to make sure that they are actually in pain and that they actually need it, because a narcotic can be very addicting and we're not trying to help them with their addiction if they are addicted to narcotics. So we need to make sure that we know what medication we will be giving. So we're giving morphine. So this, we need to inform the patient before giving it to them that it may cause dysphoria, hallucinations, nausea, constipation, dizziness, and itchiness sensations. We need to make sure that the patient is aware of that before we're giving it. And we need to make sure that we know what other medications the patient is on, because their morphine causes a lot of drug interactions, and we need to make sure that there's no medication contraindications before we give the medication. So when preparing morphine, morphine comes from an amp. So we have our 1 milliliter amp that we will be using. We have our blunt fill needle filter. We have to use a filter needle because this is glass and we will be breaking the top open. So in case there is any glass shards in there, we need to make sure we are filtering those out. And then we have our needle and plunger. So our 3 milliliter 25 gauge needle that we will be using. We need to make sure that we are cleaning our patient before we do it and cleaning our amp. So I will get started with this. I will bring our patient again. So before this, we need to provide some hand hygiene. We need to clean our amp before breaking it. So we're going to clean the neck of the amp. Nice and good, and let this air dry. While that is air drying, I will prepare our needle and our filter. So we're going to open the package, just grabbing our plunger at the time, and then grabbing our blunt needle filter, and we are going to twist this on and have it ready to go. Again, we need a filter needle because we want to make sure we are filtering out any glass shards that there may be. So for opening an amp, at first we want to make sure that there's no medication in the top of the amp. So we're going to flick it quick to make getting all of the medication into the bottom and out of the neck. With a piece of gauze, we are going to break the neck of the amp away from our hands. So doing that, breaking it and setting it back down. This, because it's glass, needs to go into the sharps bin, so I will dispose of that in the sharps bin. Now we're going to remove our lid from our filter needle without contaminating, putting it straight down into the morphine and getting out the desired amount we need. Because the doctor's order said 5 milligrams of morphine, our amps come in 1 milliliters, which equals 10 milligrams. So we are going to be removing 0.5 milliliters of liquid into our needle. So we're going to remove 0.5 milliliters. Oh, and our plunger's a little stuck, so I'm going to unstick it quick. There we go. Now, I went a little over, that's okay. We're gonna get our air bubbles out, and then we're gonna squeeze till we have 0.5 of our liquid. It's okay if a little come out. So there we have 0.5. Now we're gonna one-handed scoop our lid back on. Remove our filter needle and dispose of this into the sharps. Now we need our needle. So we're going to stick this on and get this ready and prepared to use. So set this down, move our amp out of the way so we are not spilling any, and we're going to get our alcohol pad and we are going to clean our patient again. Letting that air dry. So now that we're ready to give our injection, we're going to pull the safety down, remove the cap from the needle, with our safety upwards, we're going to go, I need to use my dominant hand, sorry, so I'll turn the patient. We're gonna go 90 degrees into the orange because this is an intramuscular injection, so we wanna go straight into the muscle. So I will do that. Straight in. At a slow and steady pace, we're going to inject the medication. Also, because this is an intramuscular injection, we're going to wait at least 10 seconds before removing the needle. So that was about 10 seconds. So we'll remove the needle at the same angle that we did. Put our safety back on our needle. And then we're going to dispose of this into the sharps bin. So now that we finished our intramuscular injection, we're going to record this on the MAR and also record this on the narcotic sheet with 2 signatures, because when you're removing narcotics from the narcotics drawer, you want to make sure that you have 2 signatures in case some of the narcotics go missing. You can be safe and always know that you will be covered because you had a witness within taking the narcotics. You always want to make sure you are following your workplace's policies and procedures because every place is different with this. Thank you.